Hi.
I'm Courtney. I'm going to be your dental hygienist today.
Nice to meet you.
Nice to meet you. Go ahead and have a seat.
Thank you.
Okay, so last time we met, we talked about how cavities form. So today we're going to be talking about why it's so important to take proper care of your teeth and how you do that.
Okay.
So a little bit about why. It's important to take proper care of our teeth because it removes the food and the plaque that builds up throughout the day.
Okay.
And it's important because when you eat something with sugar in it, the sugar combines with the plaque that surrounds your teeth, and then it creates an acid which breaks down your teeth and can create cavities like we talked about last time. If you don't take proper care of your teeth, it can be linked to many other health issues such as cancer or heart disease.
Wow.
It's not just about having a perfect smile, it's about taking care of yourself and your whole body.
Okay.
In an ADA study, they found that 30% of people were not brushing their teeth enough, which is a lot of people. That's a big percentage of Americans.
Yes.
And this is important because it's important for me to be teaching you this just so that you know how to do it, and so that maybe you could teach somebody how to do it in the future too.
That makes sense.
So, and we're supposed to be brushing our teeth for 2 minutes twice a day.
Okay.
And flossing at least once a day.
Okay.
You can also use rinses and stuff like that once a day. And so we're going to talk a little bit about how to brush your teeth.
Okay.
So I have my little model right here. And I'm going to open it up. So we want to use a soft toothbrush when we're brushing our teeth. It's recommended for most people. The only reason to use like medium toothbrushes would be like if you have dental implants or things like that.
Oh, okay.
And so a soft toothbrush is important because you could tear away at your gums and also the enamel on your teeth. So we want to use a soft toothbrushes and be very gentle around your gums, but do brush your gums. So how we're going to do that is we're going to go in at an angle, at a 45-degree angle in a circular motion, and we're going to brush our teeth on all sides. And by all sides, I mean the front,
okay,
the back, as well as the bottoms.
Okay.
So it's important that we get all the sides of our teeth just so that we can get a good, thorough clean. Some people don't know this, but you also should always brush your tongue.
Oh, okay.
When you eat something, there's little particles of things that can't be digested and swallowed. So then they collect on your tongue and they just stay there until you brush them off. So that's why when some people stick their tongue out, they have like yellow on their tongue. That's why.
Okay.
So we want to be gentle and thorough when brushing our teeth. Now we're going to talk a little bit about how we floss our teeth. So you want to get out a pretty good size piece of floss just so that you can wrap your fingers around it. So when you get out your floss and you floss your teeth, you want to go up one side and down the other. And you want to do that for every single tooth. And the reason why we do this is to get all of the things that the brush can't get from in between our teeth, as well as break the bonds between your teeth. When you eat something, the plaque forms a bond between your teeth, and it's important to break those bonds so that they don't form together and create a cavity.
Okay.
So now we're going to talk a little bit about the rinses that you can use when caring for your teeth. I would suggest that you use an alcohol rinse before you brush your teeth, and this would normally be in the nighttime. You would do a kind of just brush in the morning, and then in the nighttime you really want to go in with all of these things.
Okay.
Just so that overnight you don't have cavities forming. An alcohol rinse would be what you would start with.
Okay.
This would get all the germs out of your mouth before you brush your teeth, just so you can really get in there and get a good thorough clean.
Okay.
A fluoride rinse, which has the active ingredient sodium fluoride, is also what is in toothpaste.
Okay.
This stays on your teeth, and so this would be for like the nighttime. You would stay on your teeth all throughout the nighttime and it would be protecting them.
Okay.
And this helps keep the it protects them and helps keep the cavities away.
Okay.
So, today we've talked a little bit about why it's so important for you to care for your teeth and also how to properly do that. We're going to do a little assessment, and I'm going to ask you some questions and just answer them as best as you can, okay?
Okay.
So, what can improper care of your teeth lead to?
Cancer, heart disease, other health conditions.
Yeah, some pretty serious stuff, right?
Yeah, definitely.
So, what kind of brush can you use, or should you use?
A soft bristle brush.
Soft bristle brush. Yes, that, what you said. And what kind of rinse should you use after brushing and flossing your teeth?
After the fluoride rinse.
The fluoride rinse. And also, I forgot to mention that when you're flossing your teeth, it can be at any time of the day. It doesn't have to be at nighttime, but some people suggest it at nighttime just as part of their routine. But if you feel like you're too tired or whatever, you can go back and floss your teeth whatever time of day.
Okay.
And how confident do you feel in your abilities to do this at home?
I feel confident.
Nice. Okay. So I have some cards for you with diagrams on them, just so that when you go home and you might be a little confused, you can take those home and use them. When you're
Great, that'll help.
brushing and flossing your teeth at home. And that's all I have for you today. Thank you for your time.
Thank you.
Next time we're going to talk about proper care for braces, just in case you ever have braces and need to care for those.
All right. Thank you.
Thank you.